My name is Randy Bigley. Joining me on the podcast right now, we're talking to Dr. Price. He's a veterinarian at Whetstone and Lincoln Way, and also North Central, correct? Is that what that is?
Yes, that's correct.
Yeah, so hey, welcome to the podcast.
Thank you for having me.
And we often hear the Lincoln Way Hospital because they sponsor the Pet of the Week on our radio station, WQEL. So
yeah, glad to do that.
Well, cool. I'm glad you can. And let's talk about something. People are probably adopting dogs here. It's that time of year and stuff. Well, puppies and all that. But it's very, very important to get your dogs vaccinated, isn't it? Your puppies, right?
That is true. And the one thing that people forget is that puppies need a series of vaccinations. Just like any human that gets vaccinated, we need to see at least 2 or 3 doses so our body can respond to it. The first one basically primes the pump or gets the body ready to respond. The second and third one are really the ones that give you your immunity. So it's important that people understand that puppy needs a dose about every 3 weeks, from 6 weeks of age up to 16 weeks of age.
Okay.
And then the rabies gets done at the final booster at 16 weeks. But a lot of folks, we see miscommunication. We get a lot of folks in the office that they say, hey, my breeder gave the dose of vaccine, but that's typical. Most breeders give a dose at 5 to 6 weeks, but that doesn't mean the puppy's ready to go out. And so we want that puppy to kind of get multiple doses every 3 weeks to 4 weeks. And then I also ask people to keep that puppy at home those first few weeks, right? Work on bonding with that puppy. Don't be taking him out and showing him to everybody. Show him to all your friends,
Right, sure.
Keep that puppy at home and keep him not exposed to other dogs. Don't take him to the dog park. Don't take him to get groomed. Just work on bonding with that puppy those first 6 to 8 weeks you have him.
That's very important, isn't it, for the health, right?
Extremely important.
What kind of vaccines do you do on puppies? Do you use for puppies?
So typically we'll start ours. It's a multivalent vaccine. It's got multiple viruses in it. It's called the distemper shot. That's what we all know it as a community. But it's distemper, adenovirus, parvovirus, and then the later ones we add lepto to it.
Okay.
So if we get a puppy in at 8 weeks, say that's the most common time they bring him in, owner's given a shot at 6 weeks. We'll give them a shot of the distemper, adeno, parvo virus at 8 or 9 weeks, and then about 3 weeks later, we'll give them the distemper with lepto. And then they get another distemper with lepto at 16 weeks. And that's basically getting them started off on a good plane. Every dog, even regardless of size, gets the full dose. The only time we make an exception is if they're a little Yorkie or a little Min Pin. We'll back that dose off a little bit. But most of the research shows that unless they're extremely small, they need to have a full dose of vaccine.
What happens if you don't get your puppy vaccinated? What could happen?
So I'm glad you brought that up. We've seen a tremendous amount of parvovirus this summer. I've been practicing in the area since '95 and just moved to Bucyrus about 5 years ago. And we've seen more parvovirus this summer than I've seen the last 10 years combined. It's a very devastating GI virus. These puppies vomit, they get diarrhea, and it will carry on for days. There are parvovirus strains that affect all species, but the one that affects puppies are species specific. It won't cross to different species, to cats or to humans or anything, but it will be very stable in the environment. So the cold weather allows it to be stable outside. When they go to the dog park, if it lays anywhere around water, it'll be stable around water. Can be carried on shoes and on boots in and out of houses. So these puppies get extremely sick. It basically mows off all the internal villi in the GI tract.
Oh, wow.
And it takes a puppy 7 days to grow all that back.
Oh, wow. Yeah.
And they can't absorb anything because those villi are missing now. So think about a grass yard, and it goes in and just clips off all those grass blades, and those grass blades are what were absorbing your nutrients. So we have to feed them with an IV through an IV catheter. We give them their anti-nausea meds, give them all the stuff we can to keep them comfortable, but it's basically a battle of time. And if they have not had any vaccines to date and they're very small, they're gonna have a tough time making it. Even if they've had vaccines, they can have a difficult time making it. Some of them might be in the clinic 5 to 7 days. And unfortunately, some of them don't make it.
Yeah.
But it's less expensive to get your dog vaccinated
Sure it is. Sure.
than it is to treat it. It's always that way, right?
It is. Yeah.
So-
Exactly. Right. Yeah. And like I said, it's about 40 years. It's been about 40 years ago, 1980, 40. That I had when it first came out, when Parvo was first, and they didn't know what to do with it. And I remember my puppy got it, and it was horrible. She was sick for about a week, and she ended up passing because they didn't,
Yeah.
she was, Well, I would say puppy. I guess he's about a year old, but yeah. But
We've
it's
actually seen you bring that up. It's interesting. We actually
Yeah.
seen we've seen some adult dogs with it this summer,
wow.
and they were dogs that had the vaccine, but it might have been 2 or 3 years ago,
Okay.
and they recovered. But certainly 3 or 4 days in the clinic and IV
Mhm.
catheter and fluids and all the attention and time cost a whole lot more than just getting them vaccinated yearly.
Yeah.
The state of Michigan actually is seeing a increase in parvovirus.
Mhm.
At first, it sounded like they were getting maybe a novel virus up there. Some of the tests that we use, the in-clinic testing we use, which is a rapid kind of a lateral flow test, they call them. They take about 5 minutes to run. Some of those were not picking it up, but when the animal then passed and they did autopsies and they sent tissues in to the labs, they found that it was still parvovirus. So they thought at first maybe it was mutating, and now they're thinking it wasn't, or just our test wasn't quite picking it up for some reason. Now, obviously, viruses don't know state lines, so that's moving down here, and I'm not sure if it's a lack of attention on the public's part. 40 years ago, you mentioned when it first came out, vaccines came out shortly later. Are we getting where we're just kind of not worried about it and we're not paying attention to it because it's not new to us anymore? I don't know, but we're seeing a lot more parvovirus than we want to see or need to see.
How often should you get a checkup for your dog?
So we recommend annually for the routine dog, right? So we do a full physical exam, and we're listening to the heart and lungs. We're checking lymph nodes. We're checking the teeth. We're checking ears, eyes, everything else. And believe it or not, we find things on those that we can forewarn people. Hey, this might be coming down your road in the near future, and we might just be able to answer some questions. We hope the whole physical is healthy. One of the big things that we all do in our clinic, we work very hard on working on people keeping their dogs in the right condition. Because just like in humans, when dogs get overweight, they get more arthritis, they get more issues moving around the house, and then that's a cascade event that just doesn't stop.
Sure.
And they get heavier and heavier. So we work on that a lot. I will say the dogs that are on our requirement in any of our 3 clinics is dogs that are on anti-seizure medication or thyroid medication. We want to see them every 6 months, just to do a blood draw to make sure that we're getting enough medication into them, because we can test the levels of those drugs in their system. So typically the healthy dog, yearly. If we have other ailments, even heart disease, we want to see those every 6 months. We've got new testing out now that we can actually test. It's a pro-BNP test. It's actually a cardiac enzyme, so we can test for that see if our heart medication is working, so that dog's heart isn't getting larger and larger and we don't know it.
Sure.
Where 30 years ago when I first started, we didn't have that test, right?
Yeah.
And so we had to go by clinical signs. So now with testing as and everything else, we can get on things quicker and hopefully have a better outcome.
How about, we have cat owners out there. How often should your cat checked up?
So cats should be yearly as well, right? Because vaccines, when we start boostering as kittens or as puppies, they get a series. But after that, usually annual is enough of a booster. Interestingly enough, it doesn't matter what species you're in. You can't get vaccines that last more than about a year.
Okay.
So cats are the kind of the same program. Sometimes we have to work with cats if they're, out in the barn and people can't catch them. They might have to take a few times of trying to get it caught to bring it in. So if they slide a month, either way, it doesn't hurt anything. But cats are still on a routine annual basis.
All right. What locations do you have? Where you're located at?
So our Whetstone office is in the Whetstone Plaza here in Bucyrus. Our Lincoln Way Animal Hospital is in Upper Sandusky, just on the east edge of town, right on 330. And then our Sycamore office, North Central Vet Services, is right on the main highway going north out of Sycamore.
All right. Well, thank you so much for all that information. And if they're interested in an appointment or something, do you have like a social media or anything or a website?
Yeah, we have a website and we have a Facebook page and keep up on that. And then we've just recently started a new call center.
Okay.
So if they call any one of the numbers, the Whetstone office number, or the Upper number, or the Sycamore number, they're all going to go to the same call center.
Okay.
But we can get you an appointment at any one of those 3 offices.
All right. Dr. Price, it's so great to meet you. Thank you so much.
Thank you. Appreciate it.